In a health battle that tested the limits of human strength and resilience, Bill Bolden and his wife Kim both found themselves up against the unexpected at the beginning of the 2023 year.
William Bolden.
And I'm Kim.
And we are from McConnellsville, Ohio. I've been a patient with Memorial Health System for a long time.
As a highly active individual, Bill recalls a few days of intense exercise that led up to his first symptoms of tingling in the feet and legs.
Well, I went to the gym and I'd worked out pretty rough for like 3 days, and I thought I'd overdone it. And my legs were starting to tingle, and I could feel it tingling in my feet. I was getting in the shower at night and just lay down in the tub and just hot water. I mean, just straight hot water to make the tingling stop. It hurt so bad.
This was like a week and a half of him having all of this pain, like so much pain he couldn't sleep, he couldn't eat.
And then one day I was walking through the house and my right knee gave out and didn't pay it much attention, you know. I'm getting old. Next day I was sitting on the foot of the bed talking to Kim, and I went to stand up. Both my legs buckled at the same time and I fell flat on my face. I didn't have enough upper body strength to push myself up off the floor.
So it kind of clicked that, hey, you know, this isn't just muscle weakness from working out too hard. Something serious is happening. So that's when we better go to the hospital.
Arriving at Marietta Memorial Hospital's emergency department, Bill was quickly admitted, and his care team was quick to begin finding a diagnosis.
And what was the next day?
Yeah, within a day or two.
They had a diagnosis.
Yeah, you have to have a spinal tap. The spinal tap is the confirmation of what it exactly is.
I'm Rich Hoyt. I'm a physical medicine rehabilitation doctor, and I've been with the system. It'll be 10 years this summer. Bill had Guillain-Barre syndrome, and that's a condition that typically occurs after either a viral infection or sometimes after a vaccination. And it's an inflammatory response, and it affects peripheral nerves. And so it can affect muscles and can even affect autonomics, or things like your bladder and other functions.
Bill's condition continued to grow worse to the extent that his lungs started to fail.
If he'd been there another couple days, he would have died, or if he had gotten COVID, he would have died.
The decision was made to transfer him to Columbus, Ohio, where he was admitted to an intensive care unit.
He spent 34 days at Riverside,
Yep.
In and out of ICU, and mainly in a step-down unit from ICU.
Had to have a trach put in.
Yeah, he was on the vent. Every tube you could think of in and out of his body. The pain was
Just sucked.
just unbearable. His body kept declining. He couldn't even move a finger or move a toe. He was basically paralyzed from the neck down. Bill has a never give up attitude.
Don't quit.
I think it stems from him being in the Army, and he's a fighter and he won't quit.
Upon Bill's return home, he and Kim met plenty of people who took care of him with the utmost compassion, which he thanks tremendously. Jamie Israel, physical therapist, is one of the team members at Memorial Health System who made a lifelong impact.
My name is Jamie Israel. I'm a physical therapist, and I've worked with the health system for 11 years. Being the physical therapist, my job is to help somebody become functionally mobile again, to learn how to get in and out of bed, to stand, all those kinds of things, so that they can leave the hospital and go home and be independent as possible. Well, when Bill got here, it was very challenging because he actually did not have any use of his arms or his legs. So initially, we were just working on range of motion, stretching so he didn't get joint contractures, trying to work on just strengthening his core. He wasn't able to sit up on his own at all. He had no ability to balance himself. So we would use machines to transfer him because he couldn't physically transfer himself.
Transitioning from a traumatic life change such as Bill's diagnosis could often discourage one from seeing the positive side of things, especially with providers elsewhere telling Bill that he may never walk again and enjoy his active lifestyle.
You go from benching a little over 300 pounds to not being able to
Pinch a clothespin. You don't realize how much your body declines after you've been laying in a hospital for 3.5 months. You know, he had no muscle tone. He'd lost over 50 pounds.
Bill came in with a positive attitude. He was in a tough spot when he got to us and had a pretty big change in his life. So I was impressed with his attitude. He came to work. He came to be positive.
With a long road still ahead of him, Bill's physical therapy then transitioned to Memorial Health System's outpatient therapy services at Frontier. There, Bill met 2 more team members, occupational therapist Rob Moat and licensed physical therapist assistant Tom Davis.
My name's Rob Moat. I've been an occupational therapist with Memorial Health System, Frontier Occupational Therapy, Outpatient Therapy Clinic at the Frontier Shopping Center for 6 years now. Really, just him being able to do more things was what gave us the success that we needed, or to show for him that he was able to do more things on his own without help. We worked on getting his pain a little bit better with modalities, and we would do movement patterns to help his dysfunctional movement because he couldn't move for so long. Then once we started to get better movement out of his upper arms, then we started to prepare him for strengthening and fine motor control, to be able to manipulate things like food items and food utensils and things like that.
Just want to say, don't give up.
Don't give up. You know, this is a terrible, terrible disease, but it's not like a cancer or
Right.
stroke or something that most people can't recover from.
You can come back.
You can come back from this, and that's been our blessing this whole year, is that yes, he was very sick, and yes, he almost died, and yes, he couldn't move his body, but is he going to get better?
Yep.
Yes.
Every day.
And we couldn't have done it without Memorial Health System.
To learn more about our Department of Therapy Services, visit mhsystem.org/therapy services.